Hello, I'm Dr. Suzanne Yoder. I'm an audiologist and I own a private practice in audiology. This video serves as an introduction to audiology. I'll be covering the following topics. What is audiology? What are the types of audiologists? What are the educational requirements for audiologists? And how audiologists differ from medical physicians. If after viewing this video, you would like to share a comment or request a topic for future videos, please use the contact information at the end of this video. Audiology is the study of hearing and communication disorders. Audiologists are trained to diagnose hearing disorders of all types and formulate a treatment plan that will meet the patient's needs. They are trained to implement many of these plans directly. Audiologists are not medical physicians and therefore do not provide medical-based treatment such as surgery or medication. Audiologists provide what's called differential diagnosis, which means that they can determine if a hearing loss needs medical care. And if so, they can include a referral for a medical examination to determine if medical treatment will help with the hearing loss. Audiologists are highly trained in treatment of hearing loss for communication needs. This means that audiologists can provide solutions for hearing loss that cannot be cured by medical intervention. Audiology-related solutions can include hearing aids, FM systems, assistive devices, alerting devices, auditory training, instruction and counseling on coping strategies, communication strategies and listening skills, tinnitus management strategies, cochlear implants and other implants, hearing protection, hearing conservation, and much more. Audiologists are also highly trained in the area of vestibular disorders and will help patients with balance and dizziness problems. Since audiology is such a diverse profession, audiologists can be found in many different places. Audiologists can be found in hospitals and medical facilities. This type of audiologist would focus on hearing, medical-related hearing disorders. They typically will work in a team and may work alongside other audiologists, ear, nose, and throat physicians, otologists, neurologists, surgeons, and other physicians, nurses, physical therapists, occupational therapists, and speech-language therapists. They can be found in the clinic, assisting with appointments, in the OR, assisting with surgeries, and in the maternity ward, assisting with newborn screenings. Medical audiologists see many types of patients and perform many duties, including hearing testing, activation and programming of implants, hearing aids, newborn hearing screenings, and more. Medical audiologists may see patients of all ages, but some choose to specialize in pediatrics, and others may specialize in cochlear implants. It is also possible to specialize in tinnitus or auditory processing disorder. Audiologists can be found in the military. They work in military facilities and military hospitals. These audiologists actually join the military. They're found on military bases and in military hospitals around the country and even around the world. They perform the same roles as medical audiologists, but some of them will focus solely on hearing protection and hearing conservation for soldiers. Audiologists can be found in schools. These audiologists work with school-age children to assess the needs of the classroom and additional support that these children need for hearing and communication. Educational audiologists work alongside teachers, school administration, and other audiologists, speech-language pathologists, and parents. They attend IEP meetings and write reports to help children obtain the type of services they need in school. They focus on classroom hearing and therefore work primarily with assistive devices, FM systems, microphone systems, and the hearing aids and cochlear implants that these children wear. They are often mobile and will move around within their county or cover several counties at a time. Audiologists can be found in industrial complexes. These audiologists focus on hearing protection and training workers about the harmful effects of noise exposure. Industrial audiologists work with wellness directors, nurses, and OSHA compliance directors. They do hearing testing, make hearing protection, and train people on hearing conservation. Audiologists are found in private practice as well. Private practices can be found anywhere in the community. They can be small or large. The audiologist can work with many audiologists or on their own. Private practices will typically focus on treating non-medical hearing loss, but this is not true for all private practices. Some private practices will have contracts to work with military patients, do industrial testing, or even offer educational services. Some audiology practices can work with medical-related hearing loss by partnering with physicians in the community. Audiologists are also teachers and researchers, and they can be found in universities. They study the areas of hearing and communication that are not well understood. They conduct research, publish articles, and teach. The lesser-known audiology study is animal audiology. This is a study of hearing loss in animals. These audiologists work closely with veterinarians and often provide services for service animals such as police dogs and horses. Audiology has an educational requirement in the United States of a doctorate degree. A person interested in becoming a clinical audiologist would first earn their bachelor's degree in the field of communication science and disorders, and then go on to earn their doctorate degree in audiology. Usually this is a total of 7 to 8 years of college. An academic audiologist that's interested in teaching and research would go on to earn their PhD, although some academic audiologists do have other types of doctorates. Finishing a PhD could add another 2 to 5 years to the education process. Audiologists are required to obtain 2,000 hours of clinical experience before receiving a license. They must do this as an intern. Once licensed, the audiologist must maintain their license by attending education classes called CEUs. And this is to provide proof to their state that they've continued their education. Some audiologists will go on to obtain board certification as well, although this is not required to practice audiology or to be licensed. Board certification allows the audiologist to strive to a higher standard by taking evidence-based classes for their CEUs as well as ethics training. Audiologists differ from ear, nose, and throat physicians in several ways. The audiology degree is not medical. They do not train in surgery or medical procedures. Audiologists study more the communication issues and how to help patients reach their goals for hearing better and communicating. Physicians are trained on how to resolve medical issues of the ear, but have very little training on the communications aspect. This concludes the video. Please feel free to leave us some feedback at the end. Thank you.